Joining me today is Dr. Kevin Kaplan with the Jacksonville Orthopedic Institute. Dr. Kaplan, thanks for being here today. It's kind of been a tough year for the Jags this year.
It's been tough. It's been tough all around, and you never can predict things like injuries, and we've been going through that, and it's tough, and you got to keep getting at it and keep trying to get the victories.
So I know we talk about injuries a lot. I know a couple of injuries that have been in the news this year. The quarterback at University of Central Florida just had a devastating injury. I guess it was the same injury that Joe Theismann had before your time, right? Back during my time. But can you come back from something like that?
Yeah, so a little different. So Joe Theismann was a tibia and fibula fracture, so it was a break of the bone. Whereas this, it looks similar, but what he did was he dislocated his knee. Obviously, I'm getting the details just like you are from the media, but he tore multiple ligaments in his knee, and they said he required immediate surgery, which means in addition to tearing those ligaments, he also injured the blood supply to his leg, which is obviously a very emergent situation. So it sounds like they had to operate to repair those blood vessels. And then, I'm getting reports, in the media, you can see it, he also injured a nerve in his leg. Repairing the ligaments, we've gotten very good at that, and obviously the blood vessel, repairing that, good at that as well. The thing that really is going to determine how he does prognostically in terms of getting back on the field and even normally walking around in everyday life is the function of that nerve and how that nerve function returns over time.
So another injury is, of course, with Tua, University of Alabama. They're in the running, seems like every year for a national championship. And, we're interviewing this and the game has not aired yet, but, it looks like he's back practicing from what looked like a bad, or something that could have kept him from participating in this semifinal game.
Right, so high ankle sprains. We always hear that term. It deals with the ligaments that connect the tibia bone to the fibula bone down by the ankle.
Right. When
those two bones separate, when those ligaments become torn, there's a little bit of instability between those bones. So unlike just a regular basketball ankle sprain, when a player tries to pivot or turn or twist, those bones move and it causes significant pain. So he had a procedure called a tightrope where they put in a plate on the side of his fibula bone with what are called fiber wires that go across to his tibia bone to help stabilize those two bones. And by stabilizing those bones, they're hoping that he can return quick enough to get back to play these championship games.
Is that like a required surgery, or if he could have just stayed off of it, then maybe they wouldn't have done that, or is that something that needed to be done?
A lot of high ankle sprains you can treat conservatively. They don't necessarily need surgery. But if they're trying to get him back quicker, it certainly is a reasonable option to put the tightrope in to see if he can get back quicker.
So I'll put you on the spot a little bit here. So we got those two big games. Give me your winners for each of those games: Alabama, Oklahoma, Clemson, Notre Dame, and then tell me who the winners, who's going to win it.
Who's going to win it all?
Win the whole thing.
All right, so I'll say without Tua, I think Alabama's going to lose. All right, I think that's going to happen.
Okay.
And I think Clemson's going to beat Notre Dame. And then in the final, it's going to be Clemson taking it all the way.
Really?
I think so.
How about that? They'll get it right.
Heard it first here.
Well, Dr. Kaplan, thanks for being here today. Enjoyed it. We can't wait so long again to get together. And I still want to get you on the field sometime.
We got to do that. So I owe you one for sure. So hopefully next season we'll get that done.
Awesome. Thanks for being here.
Absolutely. Thanks for having me.